Let's look at this ultrasound finding seen on a DVT study in the femoral bifurcation. This is, in this particular case, you can see these mobile, faint, echogenic material kind of swirling with respiration or gentle compression that often settles in the dependent portion of the vein here. Here you can see the femoral bifurcation. This is actually referred to as Rouleaux flow, and this occurs when you have slow-moving red blood cells that tend to aggregate into stacks, giving it this more echogenic appearance than the anechoic blood that you can see in the other portion of the femoral vein. So because it's slow moving, because these red blood cells are organizing themselves into stacks, you can actually see them as these echogenic foci that are kind of flowing around within here. And so this can be sometimes mistaken for a DVT. Now the difference between Rouleaux formation and DVT can be figured out sometimes through compression. And so when you press down on the femoral vein, if the whole thing compresses out, then there's no deep venous thrombosis here. But here you can actually see it moving, swirling around, and what looks like maybe a clot here is actually just Rouleaux flow, indicating slow flow. The clinical significance of this is questionable sometimes. The slow flow could predispose one to develop deep venous thrombosis, since slow vascular flow can lead to that, so that's something to look out for. You can also see this if the blood is having a hard time getting more proximal in the body, so looking closely to see if there's a more proximal reason for venous occlusion is important when you see this. But it's important, I think the key importance is to not mistake this for a deep venous thrombosis.